Nursing University teaches you more about a human than medicine. I'm a final year nursing university student and a fourth year nursing university student, and today I want to talk about what nursing university teaches you about humans. Now, the first point is patients are scared, not difficult. So, one of the biggest misunderstandings in nursing university are about patients. Now, patients are scared, not difficult, in meaning, in the act, it looks quite similar. If someone's difficult and scared, it can look quite similar, it can look quite the same. But in most situations, really, patients all what they need is comfort. You need to talk to them, communicate with them, and obviously make them feel not scared, make them feel comfortable, make them trust you in a way. Obviously, there is many ways to do that, and obviously there's many manifestations of how patients are scared. Actually, there's a lot of patients, especially you find them in local hospitals, that there's a phobia of white coat. So whenever they see the scrubs of nurses, doctors, doesn't really matter, their heart rate goes up, their blood pressure goes up. It's insane. I've seen patients. Actually, just about 3 weeks ago, I was in a local hospital. There was a patient that was coming. Whenever she's inside of her house, probably alone with whoever, right? Her blood pressure is perfect. The moment she enters the local hospital, her blood pressure goes crazy. I did it myself, I did the test myself, my colleagues did it, and the doctor did it. And it was so fascinating to see how people are so much scared of just seeing the scrubs, just seeing the white coat, just seeing whatever. And a lot of the times they're scared of diseases as well, they're scared about their lives and their situations, and they have the right to do so. So when it comes to hospitalized patients, you see a lot of people that are scared and they look scared. Obviously, with the time, people who are hospitalized for long periods of time, they get used to it, they're not as scared, so they're more comfortable, they're more numb to the scares that happens. But it's one of the biggest things that really gives you an unfair advantage amongst nursing university students, that you understand that patients are scared, are not difficult but scared, and a lot of the times comforting them actually helps a lot with the situation. The second point is families react different under stress. So the reactions of families are very diverse. Some families are very supportive. I've seen families that are so supportive, it's insane. Right? So supportive of the patient, so supportive of his situation. It's so beautiful and insane and lovely. There is situations where I've seen some professional nurses in other areas, I don't know where they work, but when they come to the hospital, they're so loving of their families that they are the ones who are taking the responsibilities of communicating with them. So as an example, there's one particular that I remember. She had her father, and he had cancer, and she didn't want to tell him he had cancer. She's a nurse. So whenever she comes to the hospital, I've just seen her once, honestly. She makes sure that nobody tells him. They tell him that it's just normal procedure when it comes to hospitalization and all of that. It was actually an operation. So he operated, he did this he did this chamber for chemotherapy, and actually, although agree or disagree with her, it was so loving of a moment that she cares so much, and she did not only do that out of neglect, but you can see how she really takes care of her father. So this is one reaction. The other reaction on a lot of patients are actually the opposite situation. You see their families are abandoning them, and they really are not autonomous anymore. They cannot do what other people can do, but they're abandoned. So there's also that reaction. Obviously, these are reactions to the diseases. Now there's the reaction to you as a nurse, as a nursing university student, or a nurse in general. There's two types. So there's three. One that are neutral, they really don't care. Ones that will really support you. They'll be like, oh yeah, I really understand this procedure. I've seen this a bunch of time. I actually researched about the disease and I know a bunch of things and I know exactly what you're doing and I like it. Oh, do you want me to go out? So you're gonna do the act? Of course I'm going out. Now you have the other type of patients who have more reactions that are more defensive or scared as well. So they're like, oh, is this really necessary? Do you have to do this? I've seen this online and I don't think that this should work. Or you have difficulty just with simple communication. As an example, you want to do an act, you tell them politely to leave the room. We are doing the acts, we're doing the medicine. Sometimes you find more resistance with them. And that is normal because families react differently under stress because they are stressed themselves. Now, the third point that is extremely important that I really want to talk about is communication can calm or escalate situations. So communication is king when it comes to nursing, right? Obviously, it's different if you are a radiology nurse or that's called like health technician, but it can be a nurse. Then you are more dealing with machines. I'll say for me, I'm multidisciplinary nurse, so I have to study all the specialties. One of the biggest things that I focus on and we have to focus on as nurses is communication. Whether communication with patients, understanding what are their problems, what's the evolution, what's their progress, do they have any other signs, any unregistered signs, any new signs, any old signs, any unseen signs, etc. The evolution, etc., and also if there's any pain. But also you have to talk with their families, understand the context better, understand the familial context better, the social context better. Obviously you have to communicate with the staff, you have to communicate with the doctors, you have to communicate with everyone basically, and obviously the people that will be in the next shift and shift before you. So communication is king. Communication can calm or escalate things or situations quite fast and rapidly, especially in the emergency room or operation room. If you are not calm and you do not talk the right way and you communicate with the families perfectly, I wouldn't say perfectly, but just communicate, good communication, really things can go sideways. Because one, families are already scared and stressed and under pressure and there's a lot of fear when it comes to operations, but they really need that comfort. So communication can really calm things down, make them very comfortable, calm, secure, understand the situation, or sometimes it can make them go the opposite way. And the same thing with ignorance. So ignorance is also a type of communication. So if you do not talk to them, that can actually escalate things quite rapidly. So one of the most important things to do as a nurse is to communicate. And that's why we have an entire subject in nursing university, all an entire big subjects just about communication skills. The fourth point that I really want to talk about is empathy is a real skill. So empathy is one of the most underrated skills, I would say in life really, not only in nursing university. One, it makes people feel heard, right? We're talking about active listening. Everybody wants to be actively listened to. So understanding, empathy, having empathy, it's just gonna make your job a billion times better. The experience with patients is gonna be way better for them. Because a lot of the time they're stressed, they're scared, they're all this. Just that empathy can really make that big of a difference. So empathy is a real skill because you have to learn it. It's not one of those things that you're just born with empathy, but rather you have to actually learn it and practice it with each and every patient. And sometimes even with your colleagues and family. But as long as you practice it, it's going to really become in handy and give the patients an absurdly better experience. The fifth point that I really want to tackle down in here is respect. Respect matters more than knowledge. So when it comes to respect, respect of everybody. So there's respect of patients, respect of other authorities like doctors, professors, supervisors, and colleagues, other university students, even if they're lower grades than you actually, I believe that you should respect them. In fact, I've actually, in the service that I am in right now, I haven't told them my grade until very later on. I didn't even tell them I'm a university nursing student because there is private schools and I should be like a higher, a higher grade. I'm a final year nursing student in nursing university, but I didn't actually tell them out of respect. And that's really big in this field, in the medical field. You have to respect yourself, respect the patients as well. Sometimes you have to respect patients because a lot of patients actually have a good knowledge. And it's not only, respect matters more than knowledge, because when it comes to staff and communication and teamwork, even if you're the best knowledgeable man in the world, if you're disrespectful to other people, you cannot work. So you want to have established a good communication that is filled with respect. I respect you, you respect me, we work together, we help each other. Obviously, we have the same goal, which is to do our job better. This is obviously what nursing school, nursing university teach us about humans. As a recap, families and patients are actually scared. Second, reactions or family reactions are very different and vastly different. Communication is king. It can escalate or calm situations. Obviously, sympathy or empathy, to be exact, empathy is a real skill to learn as a priority. And fifth is respect. Respect matters more than knowledge. So please write down in the comments down below what's your biggest problem that you're facing in nursing university, and make sure I'm gonna make a video on how I fixed it for myself. Thank you.